Hi, this is Dr. Inky Parrack here from another Whiteboard Wednesdays. So today we're going to talk about stroke, but more specifically, we're going to start with what it means to have a stroke. I get a lot of questions about, does this mean just because I have carotid artery disease that there's less blood flow going to my brain, meaning I'm forgetful, I'm not as smart, and then after you perform this magical surgery, am I going to remember everything and become smarter? The short answer is not really. So let's delve into the pathophysiology and how that ties in all together. So when people have stroke, there are many different causes, but the cause that is a bit more worrisome to most people and that we deal with all the time is carotid artery disease. It is worrisome because it's something that most people do not know about. It's asymptomatic, meaning usually as your blood flow is interrupted by plaque disease in your carotid arteries, you walk around fine. There's no problem. There's no pain. Most people have no symptoms from this. So a lot of people, until it happens, they have no idea that this is actually going on inside their body. Secondly, it is also important because we can do something about it. We can do something about it before it happens, not after you've already had a stroke and things are a little too late and you've already suffered some consequence of damage at that time. When you start to build up plaque inside your carotid arteries, initially there are no symptoms because we have not just one channel of blood flow to our brain, but in fact, we have 4 different channels. We have carotid arteries on the right and the left side, as well as vertebral arteries on the right and the left side, which perfuse kind of more of the back of the brain. And even though it's not always 100% complete, but most of us have these blood flows that go up and meet and intermingle within our brain so that your brain has plenty of perfusion, even if you have some disease here. As blood flow is going through this narrow segment of your blood vessel, the speed at which the blood passes through that segment is much faster. So the velocity is higher. And since we're in Florida, you can actually equate it to when people canoe down a stream. When you're in a nice open stream, you're just canoeing down, no problems, and it goes like this. As you go across a really narrow bank, that canoe is going to go down much faster. It's just going to go like that. And same thing happens in the blood vessel through a narrower channel because of atherosclerotic plaque. That blood is just going to shoot through there. And as it does so at a much higher speed, it's going to crumble some of this plaque off. I have another segment on crumbly plaque, but this crumbled plaque your body does not like. So some of this crumbled plaque goes to the brain, causes issues. In its place where the plaque has crumbled, our body tries to put a clot on it, and the clotting material then goes to the brain. So what we are left with is the effect of embolization, or something coming off the carotid artery going to our brain, and our end target, or the end organ, which is our brain, is now blocked off and deprived of blood, and it is ischemic. And so portion of your brain then dies because of it. And if it is in the portion that has ABCs, you'll forget some parts of that. If it is 1, 2, 3, you'll forget some parts of it. That's why people come in with very sudden symptoms, not slow down of mental faculties, but it is very distinct. They come in with one side where they can't see, or face is drooping, or they can't talk, or one side is weak and they can't pick up their coffee cup because they keep dropping it. So then what can we do about this? The whole idea in the beginning right now is prevention. So we don't want to get to this point where things are going to crumble off and plaque off and go to your brain. We can always surgically help you when it's time. And when it's time has to do with the velocity. We talked about the faster it is, the more likely that something's going to break off going to the brain. So when you come in, we're going to look at your carotid arteries. We're going to measure the velocity, or the speed at which it's going through that segment. And then we will talk about how likely it is that this might crumble and what we do about it in terms of medical management if it's not that bad yet, or surgical management if we think that this is in real danger. Again, this is Whiteboard Wednesdays, another fact. Thank you.